Hi everybody, my name is Jennifer Enrique. I am a nurse practitioner in Women's Services.
Hi, I'm Caitlin Chilella, and I'm a nurse practitioner.
Hi, I'm Antonetta Lamo. I'm a physician assistant in oncology special programs. We work for the Valley Health System, and today we're answering questions from the community about what is an advanced practice provider. So Caitlin, question number one, what is an advanced practice provider or an APP?
An APP, or an advanced practice provider, is a non-physician healthcare provider, such as a physician assistant or an advanced practice nurse, also called a nurse practitioner. We can evaluate and diagnose conditions. We can order diagnostic testing, such as blood work and imaging studies. We can interpret and share those results with you and your providers. We can prescribe medications, and we work very closely with our physician counterparts. We, as APPs, can work in multiple specialties, whether it's primary care, pediatrics, surgical specialties, women's health, or in the acute in-hospital setting as well. Here at Valley, we are very proud to have nearly 200 APPs on our medical staff. The next question from the community. As an APP, what type of specialty training do you have?
It's a great question. So I'm just going to discuss a little bit about the physician assistant role. It began about over 50 years ago as a way to expand access to healthcare. PAs are educated at the master's degree level. Prior to going to PA school, PAs need to have an undergraduate degree. They also must obtain thousands of hours of direct patient contact hours. This allows PAs to have a lot of medical experience prior to going to PA school. PA programs are typically about 27 months, so that's about 3 academic years. In the first year, they are studying in the classroom, a medical model similar to that as medical students study in medical school. In their second year, they're applying that knowledge that they learned the first year in outpatient settings, inside a hospital, and they're required to have about 2,000 hours of clinical rotation hours. Upon completing PA school, PAs will have their master's degree in physician assistant studies. They are required to sit for a national board exam. In order to recertify, PAs must complete an exam every 10 years. They are also required yearly to have continuing medical education hours. This allows them to stay on top of evidence-based practices to really give our patients the best care possible. PAs can work in any specialty ranging from pediatrics to geriatrics. Many times you'll find a PA working as first assist in the operating room with surgeons, and they can work in different surgical specialties. We really work closely with our collaborating physicians to provide the best care in a team-based approach.
So similar to the PA, the advanced practice nurse's role that has existed for over half a century. The APN is a registered nurse with a master's degree, can even get a doctoral degree, and who has completed advanced education and training from a nationally accredited program. The APN's scope of practice extends beyond the traditional registered nurse's role. With our knowledge and clinical skills, we're prepared to offer preventative care to the public. We diagnose, manage medical conditions, we promote health maintenance, and prescribe medications. APNs maintain up-to-date board certifications and competency requirements in order to continually provide evidence-based care. APNs have not only been able to evolve and transform the nursing role through higher education, but we have been able to expand the access of quality care to the public, which is most important. In many ways, the APNs function as the glue between the nursing and the physician community. Caitlin, the community wants to know, will seeing an APP affect the care they receive?
Sure. There are so many ways in which your care will be positively affected by having an APP on your care team. We are not trying to replace your doctors. Rather, we work together as a team to provide you the best care. By functioning as true extensions of our physician colleagues, we can reduce wait times to see a qualified provider to address a concern or a question that you may have, therefore increasing your access to healthcare. As a nurse practitioner, my care philosophy is to bridge the nursing and the medical models of healthcare by ensuring we are able to have that personal touch with our patients and our families. We are able to support you and advocate for you and teach you and get you through some stressful periods, all while providing high-quality medical care with an advanced scope of practice.
Jennifer, how can seeing an APP enhance my patient experience?
That's a great question. We, as advanced practice providers, have the capacity to enhance patient experience through our training, our dedication to our profession, and the collaboration we provide. While we have the ability to work autonomously, It is the team-based approach with our colleagues that achieves the best possible outcomes for our patients. In women's health, our team provides patients with holistic, client-centered, and culturally sensitive care from adolescence to menopause. As members of the healthcare team, we provide both independent and collaborative care. We work closely with our OBGYN providers to deliver care you deserve. We have the ability to address primary care concerns, common and complex gynecologic problems, obstetric and reproductive health issues, as well as the menopause and postmenopause transition. In my role as a women's health nurse practitioner, I take great pride in providing care to women and their families. It is my goal to help patients make informed decisions about their health, birth planning, and pregnancy by providing sound clinical advice utilizing evidence-based information. We recognize the importance of providing inclusive care. Our role respects the patient's gender, identities, and sexual orientation. Our clinical preparation enables us to safely perform minimally invasive office procedures that are within our scope of practice.
So through the Fast Track Screening Colonoscopy program, I help patients get their screening colonoscopies without having to do the initial consultation with a gastroenterologist or colorectal surgeon. Since many of our patients really have no medical problems through the Fast Track program, a lot of our patients have never been in a hospital setting. So naturally, they're very anxious and nervous about this really important screening exam. But I make sure patients, alleviate their fears related to the procedure and the bowel prep as well. And at Valley, we promote a huge emphasis on community outreach. We really love to get out there in the community, spread awareness of colorectal cancer, encourage patients to get this very important exam, and as early detection and prevention is really important. We really care about our patients, we care about their well-being.
As a nurse practitioner in oncology, I have the great privilege of working with patients from the start of a first diagnosis all the way through to survivorship after completion of treatment. Going through cancer treatment can be very overwhelming. There are very many specialties, several doctors, many tests and treatment regimens that are often difficult for patients and families to complete. As a nurse practitioner in this role, specifically with head and neck cancer, I am able to navigate these patients through the process. I can almost quarterback their journey along the continuum. And my goal is to take the burden off of patients in any way that I can to work together with them in a true partnership. It is really a joy, as I think we can all attest, to be able to build these trusting relationships with our patients that last several years and really spanning across the continuum of care at whatever phase of life our patients are in.
Thank you for allowing us time today to explain to you what an advanced practice provider is here at the Valley Health System. If you are looking to establish care, please visit us online.